Hello everyone. So the next topic for discussion is the excretory system. So first of all, the thing that we have to know before going into detail of this system is that the excretion, what does the word excretion mean? Like excretion is a process that is important to remove all the waste materials from our body. This removal happens through different organs in the body, which are known as the excretory organs. Human body is like very active, and many metabolic reactions are happening, which results in production of metabolic wastes. And to remove these wastes, we say that they are eliminated from the body, and this process is called as excretion. So why they need excretion? Basically it is because of the need to maintain homeostasis. And if you have not forgotten, we have discussed the endocrine system, and in endocrine system we discussed homeostasis is maintaining internal body conditions and keeping them nearly at tolerable range or nearly at the set point. Some of these wastes are so toxic that they can lead to death of the person if they are not excreted. And how the excretion is done, why it is done, and what are the benefits. So basically it maintains the pH of the body, and it maintains the water balance in the body. Further, the excretory system, we need to label the parts of the excretory system, and please make sure that we also have to know that this is the system that results in production of urine. So we have to start from here. The top two organs that you see over here are the kidneys, and each kidney leave the urine, release the urine with the help of this tube, and this tube is called as a ureter. So it means that there are two ureter present in our body, two kidneys, so two ureters. Both ureters join with the pouch like structure or a bag or a storage sac where the urine is stored for some time before we excrete it from the body, and this is called as bladder. So this is bladder, or sometimes we call it as the urinary bladder. The opening through which the urine is excreted from this bladder is called as urethra. Now there are some other organs, as we discussed, which are very important to excrete these toxins from the body, like skin. Remember that skin produces sweat, and sweat has water and salts. Lungs, they release CO2, which is also a metabolic waste product. Liver is very important for many functions in almost every system in our body, but over here in the excretory system, this is very important because it detoxifies the nitrogenous wastes in our body. So it means that it breaks down fat, it breaks down amino acids, it breaks down proteins. That's why we call that it detoxify the nitrogenous wastes in our body. Now the kidneys we discussed already up, ureter and the bladder we discussed them all up. So simply, if you want to remember what is the role of the kidney, you can say that they filter the blood to maintain homeostasis, and ureters, they transport the urine from the kidneys to the bladder. Moving further, this table is the same as reinforcing in different kind of words, like skin. Excess water is excreted in the form of the sweat. It also has salt and some urea as well. Then the lungs, they excrete carbon dioxide when you exhale. Along with that, it has water vapors. Liver is like it break down the dangerous nitrogenous wastes and convert into a less toxic compound, that is urea, which is further released from the body as urine. Kidneys, they filter the blood, remove waste from the blood, produce urine, and also remove excess water from your body. Ureters are the tubes that transport the urine from kidney to the bladder, and in the bladder it is stored, and urethra is the opening through which the urine is released from the body. Explain how kidneys clean the blood. Like, what are the three main processes that happen over there? Number one, filtration. Number two, reabsorption. And number three is urine excretion. So these are the three main processes that takes place in the kidney, and where? In the nephron. So we should know that nephron is the basic unit of the kidney. It is the basic structural and functional unit of the kidney, and we need to see where these three processes take place, like where filtration, reabsorption, and excretion take place. Now we need to know further that you have to just go through this diagram to analyze that this is the basic structure of the kidney. The blood comes to the kidney with the help of renal artery. So renal artery brings the blood to the kidney, and when the blood is filtered, it goes out of the kidney back to heart by help of renal vein. So renal vein always contain the filtered blood. Okay, now how this whole process happen, you can see that this highlighted area in the kidney, let us see what it is. This is called as nephron. So this is the basic structure of the nephron. Same thing over here, you will see the red color is the renal artery. Renal artery is going from the kidney into each and every nephron, and they reach the first part. We will go to the second picture. Let's go here, this is easy. So this is elaborated structure. Now you have this artery, that is the renal artery, which brings the blood to the kidney. From the kidney it goes to glomerulus, which is a bunch of capillaries present in a cup-like structure called as the Bowman capsule. So due to high pressure, the blood enters, as the blood enters into the artery, the pressure is very high. So due to high pressure, the blood is filtered, and all small materials, they leave the blood vessels into the nephron. So that's what we say, that as the blood enters the nephron through capillary from glomerulus, the blood is filtered, and now this is called as a filtrate. The filtrate flows into the tubule. Remember, only small molecules will leave the capillaries, while the large molecules, they remain in the capillaries. After that, the blood will go down into this U-shaped tube. You can see this U-shaped tube. This is called as loop of Henle. So the second process takes place over here in this U-shaped tube, but that is called as reabsorption. In this reabsorption, we have to say that the water and many other important substances that were lost from the blood in the glomerulus, they are reabsorbed. Okay, so we say that they are reabsorbed and goes back into the capillary wall. In the last part, after that, you see from this U-shaped tube, the filtrate needs to go into this area, and this area is called as the collecting duct. So in the last part, the urine excretion takes place. So once all the water and the important materials are filtered, the waste materials or the filtrate, now it is called as urine, that goes from the collecting duct in through ureter into the bladder, and then into the bladder into the urethra, goes out of the body. These are the same parts we discussed, how it is excreted, how urine is excreted, like what is the pathway. So from renal arteries, it goes to the kidney, from kidney to ureter, then bladder, and then urethra. Investigate three disorders. So there are many disorders possibly, but we will focus on three main disorders, which are infections, nephritis, and kidney stones. Okay, so we have to discuss these three mainly. So first of all, what is disorder? Disorder is like anything which is not functioning properly. So what can be the possible kidney disorder? That means that the kidney is not doing its job. What is the job of the kidney? To filter the blood and remove urine. So if we say that it is not doing, so there are three possible disorders. Number one, infections. So we see over here, infections are like possibly symptoms in the kidney, which you can observe is like fever, chills, and mild to mid to low back pain. Oftenly, this spread throughout the kidney. Normally, it starts in the urinary bladder, and later on these infections spread throughout the kidney. If the kidney is blocked, we also say it as infection. What you can use to treat them? You can use antibiotics, basically, which are very effective in treating the infections. Remember, if you don't treat kidney infections, they can lead to kidney failure, like the kidneys will stop working permanently. Second one is nephritis. It is combination of two words. Neph is for nephron, okay, and itis is the swelling. So in simple words, if you know the basic meaning that this is nephron, and the second part means itis means swelling, so it means that it is kidney swelling. So it's simple now. It's either inflammation or painful swelling of the kidney, but which part? Mainly glomerulus. Okay, so when the glomerulus is swollen, it is very clear that it is blocked or it is lodged with the blood. Okay, like there were large particles in the blood. When the blood was in filtration stage, they stuck and they blocked the glomerulus. And now, how you can get to know it, that you can do the urine test. Either you find blood in the urine or you find protein in the urine. That means that there is kidney infection. You need to go to doctor and get some medication for this. Next one is kidney stones, which is the third disorder. It's quite obvious. We have stones in the kidney. They are mainly formed because of calcium. So if we are taking a lot of calcium products and our kidney is not removing excessive calcium from our body, they turn into crystals, and they are called as the kidney stones. Small stones are normal, yani they can pass through your body, but the larger stones, you need to break them by the help of ultrasonic sound waves. Okay, so you need specific sound waves, they break them. And sometime we need surgery even to remove the larger stones from our body. Kidney can also be damaged by other diseases like diabetes, high blood pressure are the very common diseases which can cause the kidney disorders, and they lead to kidney failure, and the functions of the kidney will be disturbed. In addition to that, kidneys can also be damaged by prescription and illegal drug use. So like if someone is using drug illegally or overtaking any medicine, so that can also lead to kidney disorders. Now, if someone has a kidney disorder, the kidney is malfunctional or the kidney is not working properly, they need to treat it. So what are the treatment methods? We have two main treatment methods. Number one, dialysis, and number two, transplant. So we have kidney dialysis and we have kidney transplant. So let's just discuss kidney dialysis. Dialysis like a temporary treatment. It's like on and off. You need to redo it, do it again and again. The doctors, they use an artificial kidney, that is a machine. They connect the machine, which has two pipes. One pipe is connected with your artery, which brings the unclean blood and that is taken to the machine. Over here you can see that is taken to the machine, and this machine has good products over here. So due to high concentration of the toxic materials in the blood, when the blood enters the machine, the waste products diffuse out of the blood and go into the machine, and good products go from the machine into the blood. So blood is returned from the dialysis machine to the body, that is filtered, and it filters the toxins and the wastes from the person's blood. Now, dialysis is basically a procedure in which artificial kidney machine filters the waste and toxins out of the blood. There are two types of dialysis. So one is that we just discussed, that they connect the machine temporarily to the arteries, and the blood is also returned through the blood vessels like into the veins. It takes 3 to 4 hours, and you require to do it 3 sessions per week, like every other day. The patient has to go to hospital, stay there, and do this for 3 to 4 hours and come back. There is a second type of dialysis in which they put the machine, or they connect the machine with the abdomen, which is like faster, and it just need 30 to 40 minutes to finish. But again, this has to be done on regular basis. The next thing is the kidney transplant. Transplant, again, it is a combination of two words, transplant. So it means that we need a donor who gives the kidney, which is a functional kidney. Doctor take his kidney and they connect the ureter of your kidney, yani your body, with the kidney, which they take it from someone. Okay. So this needs a surgery. You need a kidney from a person who can give you. He is called as the donor. But there are some issues with this one. The issues are, the kidneys are in limited supply. Of course, no one will give you the kidney. Why they will give you the kidney, basically? So there are the limited supplies of the donated kidney. In case if even you get the kidney, there are complications like rejection. Your body may not accept his kidney. Maybe the donor has some disease. Maybe the blood group doesn't match. Okay, so that is known as rejection. But doctors have some other ways also to deal with this rejection, and they say that you can use medicines like steroids and cyclosporin. These are the drugs that the recipient has to take it before the organ transplant. And many transplant patients also need blood pressure medications and other drugs that can prevent further infections of the kidney. So that's it. This is for the kidney. Now quickly we will go through the questions, and I will give you a hint. All the answers you can find from the top text. Don't forget the elimination rule. I will just discuss it in a minute. So first question, like, select all that apply. What are the functions of the excretory system? So we discussed that it does remove wastes, it does maintain pH, it removes excess water, and it helps in maintaining homeostasis. So it means all of these are correct answers. What are the functions of the major components of excretory system? Skin, I'm sure you still remember that it produces sweat, that has salt and water. Okay. Lungs, they release carbon dioxide as waste, so you can say that I'm just going to write it as CO2. The kidneys, it's quite easy as well. The function of the kidneys is to filter the blood, to remove waste and toxins. Okay. Now which of the below is major organ of your excretory system? So remember, elimination rule. So we are going through now the elimination rule. and this elimination rule means that the major is definitely the kidney. Then we have to name and describe the 3 steps we discussed. I will just name the steps over here. You can go back and read the processes. So the first step was filtration. The second step was reabsorption, and the third step was excretion. So these are the 3 main steps that happen. You can go back up and go through it. The kidneys are made up of millions of functional units. So definitely the functional unit of the kidney is the nephron. Label the important parts of the excretory system. You can easily label A is over here, so it means that it is the kidney. B is the bladder, C is the ureter, and D is the urethra. Now going further over here, this is nephron basically. E as a whole structure, so don't ignore it. E is mentioning it as a whole structure, which is nephron. The first part of the nephron is the Bowman's capsule or glomerulus, 2 loop of Henle, and 3 is the collecting duct. What are the symptoms, causes, and treatments of these 3 problems? So we have done all these over here. So this is here. So infections, nephritis, and kidney stones. So please read them one time more so that you can answer this question. Okay, few more. Dialysis is a treatment option for the kidney failure or significant loss of the kidney function. Which of the below statements are true? This is very important, boys. They say that are true or not true. Select all that apply. Okay, it is like an artificial kidney machine. So yes, it does. It is an artificial kidney machine. It removes the old blood. No, we don't remove the blood. The process only has to happen once, as the results are permanent. No, we discussed that the results are temporary. It removes the waste and toxins from the blood and returning some filtered blood. Yes, so that is another option. Sequence these into numbers. So we discussed already how the blood enters to the excretory system. So renal artery should be number 1, which take the blood to the kidney, and the kidneys they send it to the renal tubule, okay, which is like the nephron. From the nephron it goes to the glomerulus. Okay, from glomerulus it goes to Bowman's capsule. From there basically it goes to loop of Henle, which is not here. Then it goes to the collecting duct and the ureter, which is here. Then it goes to the bladder, and then it goes to the urethra. And that's it. We will stop here and see you in the next video for the nervous system. I hope that you will learn it and you will do best in your exams for the topic. Thank you and enjoy your day.